Tennessee State Building Commission approved replacing the Moccasin Mental Health Institute, but that decision did not come without opposition.
The location will remain on what's now a historic archaeological district. Grayson Gordon joins us in the studio to explain. Grayson.
Greg, Cindy, the facilities currently on the land were built before it was declared a National Historic Landmark in 1986. Now some are concerned that even more rich history will be destroyed with the new construction. The state commissioners voted yes to the new construction of the Moccasin Bend Mental Health Institute on historic land.
We believe that the best option when considering the budget, the schedule, the proximity to local staff resources, and mental health needs is to remain on the small portion of the 86 acres the state owns on Moccasin Bend.
Testimony from a resident says the current location is a beautiful scenery for patients.
Clients openly admire the view while they're out in the courtyards or walking between the buildings.
But that beautiful scenery has been a National Historic Landmark for almost 40 years, along with the Bend being declared a National Archaeological District in the early 2000s.
Moccasin Bend contains so many layers of history, and these non-conforming uses or outliers happened before we fully realized and had a well-documented examples of just how important this land is.
The goal of the Chattanooga Mayor Tim Kelly administration was to move the facility to an entirely different location. It was admitted at the Thursday meeting that 40 other locations were surveyed before deciding to move forward with the decision to stay. The reasoning behind it is finding a plot to accommodate the size of the new facility, and parking alongside providing privacy is challenging. Although a benefit of moving is having better access to public transportation and other resources.
Moving closer to other providers would provide synergy, accessibility, and efficiencies of a shared campus.
The first phase in an archaeological exploratory survey, and that will take about 4 weeks to determine how to move forward.
And we really do want to be good partners in the Chattanooga community. We really do want to do what's right, very, very much based on what people have said today.
The current facility was built back in 1960 and needs an upgrades to more beds to accommodate patients. Back to you, Greg.